Today we did our project on eating disorders and how they affect the lives of people and the way social media interacts with eating disorders. Our first eating disorder was anorexia nervosa. It is an emotional disorder characterized by an obsessive desire to lose weight by refusing to eat. Many people with anorexia have a distorted image of themselves and think they look different than the way they really do. Some symptoms of anorexia nervosa are severe dehydration, muscle loss, a slow heart rate, bone density decay, fainting and dizzy spells, fatigue and chronic loss of sleep, Our second eating disorder is bulimia nervosa. This is an emotional disorder involving distortion of body image and an obsessive desire to lose weight, in which bouts of extreme eating are followed by depression and self-induced vomiting, purging, or fasting. Symptoms of bulimia nervosa are gastric ruptures, which are tears in the stomach from purging, an electrolyte imbalance from constant purging, tooth decay from the vial which comes up after purging. Our last disorder was binge eating disorder. This is the consumption of large quantities of food in a short period of time, typically as part of a depression and other mood disorders. Some symptoms of binge eating disorder are heart disease, type 2 diabetes, high blood pressure, and depression. There are two main ways of treating eating disorders. If there's a severe amount of malnutrition, often people are sent to the hospital because of near-death experiences, normally due to heart failure and a lack of nutrition. This is called malnutrition. The second way people are treated is they go through extensive therapy. They often are forced to talk through their feelings and evaluate what has been causing their problems. Often people are very resentful of treatment at first, but then will soon go and feel more comfortable talking about their feelings. After treatment, sometimes patients may relapse their disorders and may find themselves struggling with it again. Now we will talk about social media and eating disorders and how they correlate. First, we have the spread of mainstream media. Much of these spreads are from Instagram, Snapchat, and Facebook. Many people will share and like large amounts of pictures which are then characterized as special. These characters normally show the ideal woman and man. The ideal woman tends to have large thigh gaps, tall legs, perfect hair, clear skin, white teeth which are straight, and the ideal man has to be strong, tall, chiseled, and flawless skin. Over the time since 2000 to 2016, there has been a large amount of social media use and eating disorders. It has grown at a linear rate. This is scary because more and more people are experiencing life-threatening eating disorders. Media is also spread through popular magazines such as Vogue, US, 17, and People. People often read through these, and many of the ideal woman and man are viewed in these. Now, how can you help people with eating disorders? Well, there are two major ways. One is you can try and talk to the person who is suffering from one of these eating disorders. Now, you cannot specifically say, I know you have this eating disorder, or diagnose them with one because you are not a trained physician. But you can get a good idea and you could try and talk to them. Also, if you suspect something is wrong, then you can talk to someone who may be able to help that person. You can tell them that you're worried about them and that you would like to be able to help them, but cannot do it without their help. Getting these people their help can be very important. Thanks for watching our video. Hope you guys enjoyed it.